at 6.
New here at 6, season-ending knee injuries for two of South Florida's top professional athletes and best-known stars. Dolphins wide receiver Tyreek Hill and Panthers captain Aleksander Barkov both suffering a torn ACL in the last week. The recent injuries have a lot of parents thinking about how we protect our younger athletes.
Our reporter Jay Jarvis spoke with an orthopedic surgeon about how student athletes can work to prevent these kinds of injuries.
Miami Dolphins wide receiver Tyreek Hill's knee injury on Monday Night Football left many watching at home cringing and mourning the end of the athlete's season.
You can see the knee dislocate, which was quite the gruesome scene on Monday Night Football against the Jets. More commonly, we see injuries that sustain just one ligament of the knee.
Dr. Deliberato is an orthopedic surgeon with Palm Beach Health Network who specializes in hip and knee work. He says while not as severe as Hill's injury, ACL tears are the most common injuries seen in high school athletes.
Certain sports are more commonly to experience this injury. It's usually it's usually a pivoting motion without a collision that causes this injury, and we find it more in women due to the shapes of their legs. And we see this injury often, and it's because of the way the sport's played.
He says many athletes, regardless of gender, play at a high level without proper progression and strength training to build the muscles that stabilize the knees.
What we call our dynamic stabilizers. These are the muscles around the knee. When they are trained appropriately, they act like an orchestra and work in perfect symphony so that the knee is stabilized when they're performing these high impact and pivoting exercises.
He suggests parents work together with their kids to be proactive to prevent injury, like finding a therapist who specializes in that kind of training.
I would suggest they find someone that is very well equipped with working with athletes and functional training. So that means that you're not there working with the trainer to get just stronger, but you're working there to become truly athletic, and that you have the appropriate mobility and that your body is functioning at its maximum mobility so that you can help prevent injuries.
Jay Jarvis, WPBF 25 News.